in this area of sexual and fertility rehabilitation, I think a lot of clinicians have difficulty broaching the topic. And partly it's because they don't have experience in it, and they're not sure how to do this in a professional way.
There's so many things that define sexuality and that make it different for each individual. So the more that nurses are taught about that or are made aware of it is really important. Oftentimes it's the nurse in rehab that is hearing about it firsthand. That's the time when you're getting your first erection, or, and you don't understand why it's there. You can't feel it. You don't know why it's happening or why it isn't happening. So those questions get put out first. And that's when a nurse can say, listen, well, we've got a great sexual health department and we can refer you to that, or we can direct you to their services.
The three-step method is that you couch the question in a way that normalizes it for the client. Many people with a spinal cord injury have concerns about their sexual health. Is that something that you have? So that you place it on the client's lap and they don't have to gather up their courage to ask you. The second part is, have you thought about this at all? Is this something that's of concern to you?
If you're thinking about sex, then you're wondering where to find information about it. So some people ask a little more ahead of time than other people. Some people are not even thinking about it. All I want to do is walk. All I want to do is get back to being me, and some people aren't. So it just depends when you're ready.
And the third part of the question would be, would you like to see somebody around this, or would you like to discuss it?
When we're all talking about it, we're joking about it at the lunchroom where your roommate and yourself are lying back talking about it. I was curious right away, so I wanted to find out what was available to me anyhow.
You don't have to have the answers. You just have to have the introduction to bringing up sexual health issues. And then, depending on your level of comfort and expertise, then you can refer on.